all of you are possibly very knowledgeable in the area of healthcare. So we work in visible diseases, mostly dermatology, but also wound care. And most of you possibly already know that AI is revolutionizing possibly every area of healthcare. All of you know that because you're experts. What you possibly didn't know is something that I want to share with you today. Okay, so to think about that, I want to ask you or ask yourself, what makes a specialist a specialist? So specialists are very important. They're special and they're actually the bottleneck of our health systems. But why are they so special? Well, for once, they can do this very important task, which is diagnosis. What is that? Well, in this case, looking at the image and guessing what is the condition present. What would you say? Guess in your minds. Okay, well, most people usually guess this right, that indeed this was psoriasis. So this is diagnosis. And we do this with a really wide range of conditions, around 300 conditions. But we're not the only ones doing that. There's a few companies in the world who are doing this with a performance equivalent to that of a specialist, like we do. But the key thing is that diagnosis is not a scarce resource. Plus, doctors enjoy doing the diagnosis. The problem is the severity measure. Now that you know that this is psoriasis, the question is, how much psoriasis do they have? And this is very, very different and very, very difficult. So we have developed AI that is able to do this very precisely. It's very, very different convolutional neural networks, and thanks to this, we have developed features that are life-changing, such as the smart referral feature, meaning that thanks to the AI that can both diagnose and measure the severity, you can make sure that the right patient sees the right doctor at the right time. And we have also AI that is able of knowing if the treatment is working, because it knows the severity of the disease, and even predicting how the treatment is supposed to work in a certain patient. And that's how we put the knowledge that is key in the beginning of the health process. When the patient goes to the doctor for the first time, that knowledge is already there, thanks to the AI that we have trained with the consensus of the specialists. So this is important because you possibly know this, but GPs and nurses don't have the knowledge, nor they're supposed to have it. And GPs only have 1 month of training in dermatology. So how do we expect them to be able to help you when you go to the primary care providers? And dermatologists, well, actually any specialists are very, very scarce. We have a huge problem of scarcity, so we better be solving this problem correctly, which is what we are trying to do with these features. I mentioned a few of them, but we have some other very interesting features, such as image quality assurance and AI that makes sure that the pictures taken by the patients are of enough clinical quality so that the health process is not disturbed. And we even have some applications like doctor and patients can interact. I'm very happy to be here because we have here people from Rivera, and Rivera were very important for us because they were our first important customer in one of the hospitals. This was around 3 years ago, and we're very grateful for them for trusting us. But we have grown a lot since then, and our main customer segments are still healthcare providers, but we also help insurance companies, especially in referral processes, and we also help pharmaceutical companies, especially with drug development, so clinical trials wherein they use our AI to assess. This is the team. I could speak to you about how we have all the technical capacity in-house, because indeed 3 of us are very technical leads, except the CEO. She's there actually with holding the phone. So she's the only one that's not technical, but the algorithms have been developed in-house. This is what we do. This is what we are. And we also have the medical expertise, or also partners and companies. But I think it's more fair to speak about why we're doing this. And it's because the 4 of us have dealt with skin conditions for long periods of our lives. In my case has been skin cancer in my family, and our CTO has been psoriasis. He suffers from psoriasis, and then she has had very bad luck. I leave it at that. And that's what drives us to do this, which is not easy. But we believe that this is necessary for us, for our families, and for people who are experiencing the same issues. And the way we do this is by helping the doctors. And that's our key, I think, that we have worked with the doctors to develop the AI. And that's the only reason why we have been able to guess which are the parts that are actually solving important problems for them. So if you think this makes sense, if you're as excited about this as we are, help us in putting the key knowledge at the beginning of the health process so we can impact the lives of so many people. Thank you so very much.